you see my monitor right now?
Oh, yes.
Yes, okay. Good evening, everyone, and it's my great honor have the opportunity to share the application of PRP in skin rejuvenation and pigmentary disorders. He is our previous president, Professor Goh, and he inspired me to explore the application of PRP in skin rejuvenation. At 6 years ago, and the evidence of PRP for skin rejuvenation is low. However, my patients, the positive feedbacks from my patients encouraged me to do the PRP studies. And we published a review last year. The long history of platelet concentrate products was always associated with confusion. And this is my favorite versions of the PRP history. The 50 years long history started with an interest for the
around 10 years ago, we start to use Bakun assistant wound closure. Although it's a good tool for wound closure, but most of the patients require hospitalization in the hospital. So for the private practice, it's not good for our patient in the clinic. Such by engineering skin substitute such as fibroblast or stem cell, our practice right now is still not quite available in our practice. So that's the reason we consider if next slide.
Yes.
Yes.
Yes, yes, yes.
Yes, yes.
So today I'm going to talk to you about the PRP for the hair regrowth. So I have no conflict of interest to declare. So about the hair regrowth or hair loss, there are two evidence of PRP using in androgenetic alopecia and alopecia areata. First, we start with the androgenetic alopecia first. We all know that PRP releases a lot of growth factors that mainly for hair is helping to stimulate dermatology cells by prolong survival of the cells, make the cells work better, more proliferations, more differentiations, and also focus on the hair cycles. Recently, this year, there are some study evidence from the humanized mouse models. This study was doing xenograft or make a transplanted hair from the scalp of the patients with the male androgenetic alopecia on the nude mice, and then inject PRP onto the nude mice once a month for totally for 4 sessions. And then they get biopsy and see what happened to the skin of the nude mice after injection of the PRP. In this study, they found that activated PRP, they activated with the calcium chloride is more better than non-activated PRP in terms of improving anagen to telogen ratios, in terms of reconversions of vellus hair into the terminal scalp hair, and enhancing scalp diameters. There are no exactly studied like the comparison in the same patients, but they compare using the systematic review or meta-analysis, because it's quite difficult to compare. Because I think the finasteride is working at different pathogenesis of androgenetic alopecia. And I never used the PRP alone to patients without using the standard treatment in my real life, because I know it is something that cannot cure androgenetic alopecia for life. You have to combine with the standard treatment anyway. But I see some improvement in terms of PRP in patients who have a lot of vellus hair. If the patient is already baldness or already severe androgenetic alopecia, of course, it's not working.
Okay. The other one that you mentioned is your maintenance study of 3 to 6 months. How long do you put them on? Do you put them on forever or anything?
Forever.
Because you know they all drop. The same applies to minoxidil and finasteride. You stop, they all drop again.
Yes, I recommend them to come like every 4 to 6 months. So patients see me only 2 or 3 times a year. It's not a lot. Yes, I have to go to see the dermatologist, right? Okay. That's a big to see you for melasma. Because if the patient wants to continue to do that, because it's not for life.
Okay.
It has to be understood for this.
Okay, we have a question. Attendees ask question for about the PRP in melasma. So they, Dr. Sylvia Tianwan would like to ask Dr. Lin about how do you use PRP in treating melasma?